Hi, this is Dr. Brian Castelein with Brighton Foot and Ankle, and today we're going to talk about swelling, especially after surgery. We always get questions with this. 100% of the time, this is involved in surgery, swelling afterwards. It is totally normal. The body needs a natural healing response to what's been done in surgery. Surgery is always a little bit of trauma. So we need the body to get extra blood flow to the area, extra healing factors to the area. We need that body's normal immune response. So some degree of swelling is normal. Some people swell more than others, and some areas of the foot and ankle swell more than others. One thing that is totally common is we get a lot of swelling in the foot and in the ankle. Think about this. When we're at the knee, by the way, this is Sophie, one of our medical assistants. When we're at the knee, a hip, a shoulder, these are bigger structures. There's more capability of the area to take extra fluid. When we're into the foot and when we're into the ankle, there's not a lot of extra space for that swelling to go. Studies show that sometimes, especially in our bigger ankle surgeries or in our rear foot surgeries, we can have somewhere from even 120 milliliters of fluid up to 400 milliliters of fluid. And if you're wondering what that looks like, well, my little syringe here is filled just with 5 cc's or 5 milliliters of fluid. Okay, so adding 120 is significant. And if we take Sophie's foot here, bend your ankle, come down, 5 is significant. Imagine this being 120. There's a lot of fluid into the area. So things that we like to do to help with this, there's a couple tricks that we can help reduce the swelling. One thing is time. The body just needs time to heal. Tendons typically heal in 6 weeks. Bones take typically around 8 weeks. So one thing is time to make this better. Another thing that can really help us out is elevation. We love to get this foot up above the waist, if not all the way above the heart. Let gravity help pull that fluid back up. When you're sitting in a chair like I am, or when you have your feet down, gravity's having the opposite effect. It's bringing fluid down to the ankle, down to the foot, making it worse. So one of the big things to do is get that foot up, again, above the waist. Another thing that we like to do is use ice. Ice helps constrict the blood vessels. Ice helps mitigate and reduce some of that inflammatory response to the area. So that is always beneficial, especially after a busy day while you're starting to get back in your post-op routine, or initially to help prevent some of that swelling in the area. Another thing that can be really useful is some massage. Now, if you're allowed to touch the surgical area, or maybe with a physical therapist or occupational therapist, we want to start at the toes and we want to massage back up to the heart. We always want to go from the toes back to the body to help bring that fluid back into the body. Another thing that can be really useful is some movement. Now, if Sophie does a couple ankle pumps for us, you're going to see that her calf muscle is really firing. This is the big driver. This helps take fluid from the toes. It's the big pump in the leg, sometimes called the secondary pump, because of course the heart's the first pump. But this is a pump in the legs to help bring that fluid back up and get it back into the central portion of her body. So some light motion, some light movement, even ankle pumps or doing an alphabet with your ankle can really benefit and get that fluid back up to the heart and absorbed. The last thing that we love to do too is we love to talk about compression. Again, this is all centralized around the calf muscle. We want to make this pump as efficient as we can, and if we compress it with a compressive garment like a sock or even a tight that comes all the way up to the groin, we're going to make that calf muscle so much more efficient, get that fluid back up out of here. But swelling is normal. A little burning, a little tingling in the feet because of swelling is totally normal, especially right after surgery. Swelling can be worse after activity as you're starting to go and get back into your normal routine too. That's where we love to use the ice, the elevation, and the compression. So try those things next time something happens to your foot, to your ankle, whether it's surgery, whether it's a sprain, and that will get you feeling better much quicker.